Brian, hi. Wanted to show you what to do with that foam I dropped off at your house. You can test internal rotation of each hip by rolling the leg inward and then give it kind of a spring, okay? And pay attention to how far it moves and pay attention to how much spring there is at the end. If it feels stiff at the end and it's less motion than the other hip, then you can take this piece of foam and you put it outside the crease of the pocket. Half is above and half of it is below that. And the foam is parallel to the outside of your hip pelvis. Okay? And you lay on a firm surface like this for 5 minutes. And it's advisable to actually treat both sides. Strangely, after restoring movement on one side, it seems like the other side reflexively tightens up. So I suggest doing it on both sides. And you could do this once a day for a week, and it'll then stay loose to where you can do it once or twice a week, and it'll maintain the benefit. Marcy could test your hip extension and see if it's restricted. And if it is, this is a technique to improve hip extension. You slide it horizontally just under the crease of your buttock, under the thigh. And this gaps the hip joint, so it facilitates a lot of receptors in the ligaments and capsule, which relaxes muscle, relaxes your hip flexors. And so surprisingly simple technique can be very effective. And that one you can do for 2 minutes, once a day for a week, and then once or twice a week thereafter. I also left you a small blue piece of foam, and that's for you to experiment in sitting. And if you need more, such as one for your car and one for your home and one for work, let me know. I can't say which hip that this is needed, so try it under both hips, but it's right under the trochanter, that bump that you feel when you roll your knee in and out. And this piece of foam goes underneath that, and it alters your hip position. It keeps the hip from falling out and causing some pinching pain. And some people don't, report pain with sitting, but once they place this on the correct side, whichever it may be, they find that they have greater sitting comfort. And so anyway, I think I'll make this a public video on YouTube, because a lot of us have tightness in one or the other hip in terms of tight external rotators, tight piriformis, and tight hip flexors, limiting hip extension range of motion. And there's a lot of folks who benefit from this. And of course you can be creative. And you could take a dowel and wrap it with a washcloth or something. Or you could buy pipe foam at the hardware store and put a dowel inside there, and then tape it with duct tape so that it will last a long time and seal both ends. So anyway, you can be creative, but we have these on our website in the for sale section. And these are Plasta-dipped foam, dipped 4 times. And that's all I have to say. I hope this is helpful to you. Anyway, take care, and hope it's helpful to the general public as well. Thanks. This is Jerry.